So this is the viscera of the brainstem. Brainstem contains midbrain, and there is pons and medulla oblongata, and there is crossover on either side at midbrain, and there is group 4 basilar artery at pons, and there is anterior median fissure, and then laterally there is pyramid, then anterolateral sulcus, and then olive, and then posterolateral sulcus, and then there is inferior cerebellar peduncle, and at pons there it is connected with cerebellum with middle cerebellar peduncle. So we have to know the course of the cranial nerves. So there is the superior and inferior colliculus at the posterior surface of the midbrain. So at the superior collicular level, the third cranial nerve, that means the oculomotor nerve, it passes ventrally. And at the inferior collicular level, that fourth cranial nerve, that means the trochlear nerve, it passes dorsally. And the fifth cranial nerve, that means the trigeminal nerve, it passes anterolaterally to the pons. And at pontomedullary junction, medial to laterally will pass 6, 7, and 8 cranial nerve. That means the abducens, facial, and vestibulocochlear nerve. And at the group between the olive and pyramid, that means the anterolateral sulcus, the 12 cranial nerve will pass. That means the rootlets of the hypoglossal nerve. And at the group between the olive and inferior cerebellar peduncle, that means the posterolateral sulcus, 19th and 11th cranial nerve will pass. That means the glossopharyngeal, vagus, and cranial part of the accessory nerve. So on posterior surface at pons, there is median sulcus, and laterally there is median eminence, and laterally there is sulcus limitans and vestibular part. And also at medulla oblongata, there is posterior median sulcus, and then gracility tubercle, and laterally canute tubercle.